On कर दिया ना? Yes. Okay, so we'll start this webinar. So myself, Dr. Navneet Singh, and a very good morning, good afternoon, and good evening to all participants joining us from different parts of the world. On behalf of this organizing committee, I warmly welcome you to this international webinar on improving livestock health and productivity through comprehensive control of Hemoprotozoan disease and Ectoparasiticide, which is most economical disease, means which leads to more economical losses to the farmer. Today's session brings together expert and field veterinarians who have contributed immensely to the animal health and productivity across diverse regions. Right? Now it's my pleasure to welcome our first distinguished speaker, Dr. S.W. Kolte, sir, for this webinar. Welcome, sir. And I welcome all stakeholders, including veterinarian, farmer, and different poultry consultants from different countries. I welcome all colleagues of Oasis Life Sciences who joined from different countries. And I also welcome my panelists, Dr. Abhijit, Dr. KK, and Smita for this webinar. And now I request Dr. Abhijit to start the introduction of the poultry, sir, and take this session. Yeah.
So, good afternoon, good morning, and good evening, everyone, depending on where in the world you are joining us from. So, again, a very warm welcome to each one of you to this International Livestock webinar, and which is proudly hosted by Ashish Life Science Private Limited. And I'm Dr. Abhijit Das from the ALS team, and it's my absolute pleasure to be your host and moderator for today's session. And it's wonderful to see participants joining us from around the globe, veterinarians, academicians, researchers, and animal health professionals, all united by a shared mission to improve livestock health and productivity. And today's webinar will be focusing on a subject that sits right at the heart of animal health and farm economics. So it is improving livestock health and productivity through comprehensive control of hemoprotozoan diseases and ectoparasites. And these challenges continue to affect livestock performance worldwide. And through today's session, we aim to understand how an integrated science-based approach can help us overcome the problems more effectively. And it's truly an honor for me to introduce our distinguished speaker for the day, Dr. S.W. Kolte, sir. And Dr. Kolte, sir, is one of the most respected names in the field of veterinary parasitology. He holds an MBSc and PhD in veterinary parasitology and has had an illustrious academic and research career. And he has served as professor at the Department of Veterinary Parasitology, Nagpur Veterinary College, MAFSU, Nagpur, and currently runs his own veterinary diagnostic and research laboratory in Nagpur. And Sir has guided numerous undergraduate and postgraduate students, published several research papers in both national and international journals, and has been the principal investigator for DBT-funded projects on theileriosis. And he's widely known for his remarkable expertise in diagnostic parasitology and for his extensive experience in the diagnosis and treatment of parasitic diseases in both domestic and wild animals. And we are truly privileged to have him with us today. And before we get started, just few quick announcements, like the sessions will be lasting around 1 to 2 hours. And you can post your questions anytime in the Q&A session. And we'll take them up during the last Q&A sessions at the end, where we'll have a discussion. And participants who stay with us till the end will receive an e-certificate of participation after completion of the session, and that will be sent to you. And yes, we'll also be announcing 3 lucky winners at the end of today's webinar with a lucky wheel spin. So everyone, please make sure you stay till the end, and you will definitely don't want to miss that part where you'll be getting an prize or award. And all right, then without further delay, let's get started. Number of attendees are also reaching good numbers, and so please join me in giving a big virtual round of applause to our main speaker, Dr. S.W. Kolte, sir, as he shares his expert insights on comprehensive parasite control strategies to enhance livestock health and productivity. Over to you, Dr. Kolte, sir.
So I welcome to all by saying Namaste. So that's the Indian way of welcoming anybody. So Namaste to all. Uh, please let me share the screen, Abhijit.
Yes, sir. Yes, sir.
Please. Yeah, yeah. So just a minute.
Yes, sir. So your screen is not visible.
Now you are not getting my screen?
No, sir.
Oh, oh, oh. Your screen is paused. Okay, wait. Just wait. Okay. Now you are getting my screen?
Yes, sir. Yes, sir.
Okay. So welcome to all. So today's our topic is on the control of hemoprotozoan diseases and ectoparasites. So always, last time also I have told you that the eradication of the parasites is highly difficult. So we as a parasitologist, we use the term control, prevention and control of the disease. So today we'll see the hemoprotozoan diseases and their ectoparasites and their control. So what are these uh, different hemoprotozoa that causes the disease in the domesticated animals? So one of them, most important, is the trypanosomosis, which is an extracellular hemoprotozoa, whereas the Theileria, Babesia, Anaplasma, Edesia, they are intracellular, present inside the cell. So everybody knows about this uh, extracellular as well as intracellular protozoa. So in the trypanosomes, there are two types of trypanosomes mainly. The three types are there. So one of them is the trypanosome, which is transmitted to the anterior part of the vector. So they are salivarian trypanosomes. And the most of the African trypanosomes, they are salivarian trypanosomes. Whereas the trypanosomes which are transmitted to the feces of the insect is called sticorarian trypanosome. That is Trypanosoma cruzi, which is transmitted to the redoweed bugs. Whereas the other trypanosomes, like say Trypanosoma brucei is there, and other trypanosomes are there, they are transmitted through the Glossina flies. So Glossina flies, of course, everybody knows they are particularly confined to the African continent. So in India, particularly in India, we get Trypanosoma euanci. We are not having any other trypanosomes other than Trypanosoma euanci in domesticated animals. Whereas yes, in rats we may get Trypanosoma levici, which is zoonotic also. So that is another story. But Trypanosoma euanci is more common in India, whereas African trypanosomes, maybe the Trypanosoma brucei and other species which are transmitted through the bite of the Glossina flies, they are common in African continent. Then the Theileria annulata, which is common in India, whereas Theileria parva is common in the African countries. So what is the difference between this Theileria annulata and Theileria parva? Theileria parva is more pathogenic and it causes leukopenia. because of destruction of the more lymphocytes. So leukopenia is there in Theileria parva, whereas in case of Theileria annulata, lymphocytosis is there. Then another one is there, Theileria orientalis. Orientalis commonly we get in the northeastern parts of India as well as in some southern parts of India, and more commonly in this orientalis we get more nervous symptoms in as compared to Theileria annulata. Then Babesia, two major species are there, Bigemina and bovis. Bigemina, they are bigger forms, completely filled in the RBCs, and by Babesia bovis, they are smaller forms. Then Ehrlichia bovis is also there, and Anaplasma marginale is there. So Anaplasma marginale, Ehrlichia bovis, nowadays they have kept them in bacteria. But both Ehrlichia bovis is found in the monocytes, whereas the Anaplasma marginale is found in the RBCs, red blood cells. So coming to trypanosomosis, again important disease of the ruminants in Africa with great influence on animal reproduction, production, all the things. Then it is actually a disease complex of the Hemoprotozoan parasite and cyclically transmitted by tsetse flies. Now, cyclically, what is meant by cyclical transmission is very simple, that whatever the trypanosomes that Glossina fly takes in her body along with the blood, these trypanosomes, they multiply inside the stomach of the fly. And after sufficient multiplication, they again comes in the pharynx of the fly. And these trypanosomes, they literally block the pharynx of the fly. So, when the fly cannot feed, the fly vomits these trypanosomes. When the fly inserts its mouth in the skin of the animal, it vomits, and it vomits the trypanosomes in the skin of the animal, and then they are transmitted. So another trypanosome is there, that is Trypanosoma evansi, which is mechanically transmitted by tabanous flies. That I will tell you later on. Then main species in the African countries are Trypanosoma brucei, Congolonsi, Trypanosoma vivax. So these are the main species, and already I told you that they are transmitted through the saliva. Then the most significant clinical impacts of the trypanosomes is the intermittent fever is there, severe anemia, enlargement of the superficial lymph nodes. There may be abortion. Abortion commonly occurs because of the hypoglycemia as well as severe anemia. Then infertility may occur if it is a long-standing chronic infection. Reduced milk yield occurs, and then the weight gain also goes down, and the animal is unable to give work output. Then in the hematological and biochemical parameters, the packed cell volume, the red blood cells, hemoglobin concentration, and MCSC, mean hemoglobin concentration, were found significantly decreased. So they are significantly decreased, and that's why there is increase in reticulocyte count. Reticulocytes, they are nothing but the immature RBCs. So immature RBCs have been thrown in the blood as the RBCs, they are continuously they are being wiped out, and then there is severe hypoglycemia. The most important biochemical change in trypanosomes is the hypoglycemia. And commonly, what happens at field level, we treat the animal for trypanosomosis, but we do not treat the hypoglycemia. Then there is no vaccine available against this trypanosomes, because the trypanosome has got two antigens. One is the surface antigen, that is a glycoprotein antigen, and another is the body antigen. So whatever the surface antigen is there, this surface antigen, which is a glycoprotein, it changes its chemical nature from time to time. So it is very difficult to prepare vaccine against each and every strain, because large number of strains of the trypanosomes they are there. So vaccine is not possible. Now coming to Trypanosoma evansi, which causes SARA in domesticated animals in India, Pakistan, and the other Asian countries, and characterized by high temperature, nervous excitement, circling movements, frequent micturition, profuse salivation, and then emaciation. So one by one we will see, and this is transmitted by the tabanous flies. Here, this is a pin. This is a laboratory specimen that I have prepared from this tabanous fly. So this is a pin. Don't say that what is this, because this is a pin. So sometimes you may get confused. And see, this is a 1 inch long fly with robust uh, wings, and this fly, it can fly kilometers away from their breeding ground, and their bites are very painful. So when the animal it bites, literally the blood oozes out, and the mechanical transmission means once the fly bite to the infected animal, then immediately when the fly sit on the body of the another animal, the whatever the trypanosomes along with the blood, they are taken from the previous animal. As such, they are injected into the body of the other animal along with the saliva, and so mechanical transmission is there. Whereas in case of African trypanosomes, it is the biological transmission or cyclical transmission is there. So that is the difference between these two species. Of course, this is also transmitted by the Stomachs and Hematopota flies. Again, the Stomachs and Hematopota flies, their bites are very, very painful. And when they sit on the body of the another animal, they transmit this trypanosomes. Then this is the video of the tabanous fly. Sorry. Just a minute. So video of the tabanous fly feeding on the buffalo. So you can see here the flies. So whatever the smaller flies they are there, they are the house flies or musca flies. Whereas the big one fly, that is a tabanous fly. You can see it is about 1 inch long and feeding on the buffalo. So, and after feeding of this fly, the musca species flies, whatever the blood that oozes out, the musca species flies, they feed on the blood that oozes out. So you can see the fly, which is about 1 inch long, slightly grayish in color. So these flies, their bites are very, very painful. And commonly these flies, they bite during the bright sunlight. That is also again their habit. Generally, they do not bite the animals in the shade. And when the animals, they go for grazing in the sunlight, these flies, they bite during the sunlight, and their breeding occurs in the water. So when waterlogging conditions are more during rainy season, the breeding of these flies is there, and that's why in India commonly the Sara occurs during monsoon season, and thereby after the monsoon season is over, you will find that the incidence of Sara, it goes down. So that is tabanous fly. Then the disease occurs in acute, subacute, and chronic. Of course, Sara is very hyperacute in horses. Then it is acute disease also occurs in horses. Then acute disease occurs in the bovines, like say buffaloes as well as cattle. And the subacute and chronic disease occurs in the particularly in the cattle and buffaloes. Whereas it is called TBRSA, that the disease lasts for about 3 years in camels. So the camels, they say if the camel is not treated, the camel remains alive for 3 years, weak day by day, and then ultimately death occurs. And that's why the disease is called the disease which lasts for about 3 years. In Rajasthan, it is called Rajasthan part of India, it is called as TBRSA. So in the camels, the disease is chronic. Of course, the trypanosomes can occur in any species of the animal, in warm-blooded animals. But commonly they prefer the cattle, buffaloes, horses, and the camels. Whereas whatever the sheep, goat population is there, commonly sheep, goat population is not affected, and the reports of the trypanosomosis in sheep and goat are rare. Maybe because the sheep they are covered by wool, goats, they are covered by hairs, and the flies, they find difficulty in biting these animals. The second thing is that the chronic carriers of the disease, like the cattle and buffaloes and the sheep and goat, they do not run simultaneously. So their grazing habit is different. So generally they do not run simultaneously near each other, and that's why the transmission of these trypanosomes is rather difficult, and that's why the disease is rather less, incidence is less in sheep and goat. So whatever these symptoms are already, I have told you that high temperature is there, dullness, the staggering gait is there, the eyes they are staring and wide open, breathing hard and noisy, nervous excitement, circling movements, beating of the head against the wall or manger, blindness, temporary blindness occurs, frequent micturition is there. So these are very typical clinical symptoms of the SARA. So in the villages, most of the villagers, they know what are the typical clinical symptoms of this SARA. But the subacute and chronic cases, they only shows dullness, lacrimation, progressive emaciation, intermittent attacks of fever, edema of the legs, and diarrhea may occur. So edema of the dependent part is again more important clinical symptom of SARA. So sometimes edema may be the brisket edema, sometimes the edema may be the mandibular edema, or sometimes the edema may be on the thigh, on the knees and all these things. So the edema is depends on the a part of the trypanosomes, or the trypanosomes, they reside commonly in the lymph nodes. So it depends on the lymph nodes in which the trypanosomes they are located. About the pathogenesis, the carrier animals, they serve as a potential source of infection, and the disease is more serious in young and debilitated animals suffering from stress and intercurrent diseases. If the animals they suffer from the viral disease like foot and mouth disease. So why it is serious in young animals? Because the young animals they have not experienced the infection previously, so they are not having any the immunity is less in the young animals, whereas in case of the older animal, again the immunity is less, and that's why the disease is more in young and as well as the older animals, whereas the middle-aged animals they suffer less. Then the trypanosomes they multiply in the blood by binary fission. And as I told you, the surface glycoproteins, because of the surface glycoprotein, the hyperplasia of the spleen and the antibody complexes may get formed and may cause glomerulonephritis and vesiculitis. So already all these symptoms I have told you, like the edema in the dependent parts of the body. And sometimes the pregnant animal may abort. Now for abortion, the reason is not trypanosome. The reason is the weakness of the animal. The body of the animal, pregnant animal, as the body becomes weak, the uterus cannot hold the fetus, and then eventually it is thrown out. So these are the macroscopic features, like say enlargement of the spleen and lymph nodes is there, gelatinous exudate in subcutaneous region is there because of hypoglycemia, then congestions in the abomasum, and the ulcers on the tongue and abomasum are there. And of course, diagnosis of the trypanosomes is very easy in the laboratory. In the laboratory, I am talking about laboratory, because you know the morphology of the trypanosomes is such that once you look the trypanosome, once you look into the microscope, wherein the slide of the trypanosome has been focused, you will never forget. It is such a simplest, I say simplest protozoa, hemoprotozoa. So in the field, we know it, we carry out the diagnosis from the symptoms. So not only from the symptoms, by considering the season also, because when the fly season is there, at that time, you may suspect the cases of these trypanosomes. And commonly the flies generally do not bite during the winter season. So winter season is, that's why we always call winter season is healthy season. Because at that time, these flies are not there, they do not bite, do not transmit the trypanosome. Then this is the video of live trypanosomes. You can see, so take a drop of blood and add 1 drop of normal saline to it, put a cover slip on it, and after putting a cover slip on it, firstly see it under 10x and then 100x, 40x, and then turn it to the oil immersion. So you will find this the trypanosomes. This video I have shot it on the phone, and just a minute. So shot it on the phone. So after just a minute. So these are the trypanosomes after staining with Leishman as well as the Giemsa. So you will find this is the magnified trypanosome. So they are very simple to identify. So diagnosis, of course, already I have told you demonstration of protozoan parasite. So lastly, I will take I will go for how to prepare a good blood smear. Then treatment includes the diminazine aceturate. Of course, we know that the first drug that we learned during our bachelor's program, the diminazine aceturate. So diminazine aceturate at the dose rate of 3.5 milligram per kg body weight. This is a trypanocidal drug. This is a cidal drug. So it kills the trypanosomes and should be given at the dose rate of 3.5 milligram per kg body weight. Should not be given if the trypanosomes are not suspected. So like say some people say PUO, pyrexia of unknown origin. There is no pyrexia of unknown origin. The pyrexia must have some origin, but we are unable to diagnose. That's why we say PUO, but don't say PUO. This diminazine aceturate is effective against only on trypanosomes and babesia. It never covers the third disease. So I think the field physicians, the field veterinarians, particularly they should not use this drug as PUO unless and until you are confirmed that this is a case of trypanosome or this is a case of babesia. Then and then you use this diminazine aceturate. Then another drug is the cunapyramine prosalt. So cunapyramine prosalt, it contains the 2-cunapyramine chloride and cunapyramine sulfate, and one of them is curative, one of them is preventive. So this is the best drug to be used for treatment as well as prevention of the trypanosomes. And cunapyramine as well as isomethylmethane chloride, if you give these two, of course, alternately, the cunapyramine as well as isomethylmethane chloride, their efficacy is 1 month. So for 1 month, whatever the trypanosomes they comes in the blood, these two drugs they kill the trypanosomes and the animal get protected. Then another one is the suramine, Gilpol is there. And the most important is the supportive treatment, that is administration of glucose as there is hypoglycemia. Of course, the glucose should be administered after the temperature is subsided. That I think everybody, as a physician, they know that during high temperature, generally we do not go for, when SARA is there, we do not immediately for, but we firstly treat and then after some time, we go for this glucose. Of course, while going for glucose, we should not use 5%, 10% glucose. For the large animals, it must be 25%, not less than that. So these are the products of this Ashish Life Sciences. Diminashish RTU is also there, so it contains the diminazine aceturate. Then another product, isomethylmethane chloride, as I told you, this is the preventive as well as the treatment. Then the cunapyramine. Of course, cunapyramine, as I told you, both preventive as well as treatment. Then prevention, avoid waterlogging conditions. As the tabanus flies, they lay eggs in the stagnated water. So in the books, it is written that pour kerosene in the ditches. But see, this is a bookish control. Pouring kerosene in the ditches uh, is not possible, because whatever the ponds they are very big, and so many are there. Even they are small, so many are there. So how much kerosene, how much diesel you will waste? So it is not possible, and again it is highly inflammable. So that is just a bookish control. But for Stomoxys flies, they lay eggs in the fresh dung. So collection and of the dung is more important, and heaping of the dung. So if you heap the dung, generally it creates a heat of 50 degrees centigrade, and the larva of the Stomoxys, they get killed. The another important thing is that if you go for a cow dung gas plant. So we here in India, we called it as gobar gas. So gobar means cow dung, cow or the uh, uh, buffalo dung. So this two we can use in the plant, that gas plant, and whatever the slurry that comes out from the plant, uh, uh, in that slurry you will find that the larvae of the flies, they do not grow. So no insect grows in that slurry, and that slurry is best manure. So I always encourage the farmers to prepare the cow dung gas plant. Then another important disease is theileriosis. So theileriosis, of course, theileriosis is there worldwide, except that in India, Theileria annulata, Theileria orientalis is there, whereas in case of Theileria parva is there in Africa. Of course, as I told you, Theileria parva, it causes the leukopenia as compared, and it is more harmful as compared to Theileria annulata. And of course, this disease is characterized by enlargement of the lymph nodes, as the parasites, they grow in the lymphocytes, and that's why enlargement of the lymph nodes, pulmonary edema, hemorrhages in the kidney, liver, ulcers in the abomasum, and catalyl enteritis. So ulcers in the abomasum, we of course, every time we say punched ulcers on abomasum is pathognomic lesion of theileriosis. So once on postmortem, if we get the punched ulcers in the abomasum, no need to go for further postmortem. It is confirmed there only that the animal has died because of theileriosis only. So again, the transmission, Theileria annulata particularly is transmitted by Hyaloma, whereas Theileria orientalis is transmitted by Hemophysalis, and Theileria parva is transmitted by Rhipicephalus species of the ticks. So these ticks are different, but all these ticks, whether it is the Hemophysalis, whether it is the Hyaloma, or whether it is the Rhipicephalus, these ticks, they are three host ticks. So the larvae do not transmit the infection. Just for your information, for the field physicians, whatever the small larvae they are there, of course, the tick larvae, they are microscopic. Here you can see these are the female ticks, whereas this is a male tick. So just for your information. So gray color, they are the females, whereas the red color, or dark red, or you can say blackish red color, and very what we call very swift in their activities, they are males. Whereas the females, they are slightly pinkish or grayish in color, and they are sluggish in nature. So these three host tick, they transmit theileriosis. How they transmit theileriosis? So the larva, when it feeds on a infected animal, the larva, it takes the infection, and this infection, it multiplies inside the body of the larva. Then the sporozoites are formed inside the salivary glands of the larva, when the larva molts to nymph. And then the nymphal stage, when it feeds on the body of the other animal, at that time the infection is transmitted. So similarly, the nymph, whichever the infection is taken by the nymph, is transmitted by the adult ticks, and then there is no trans-ovarian transmission as which occurs in case of babesia. So only nymphal and adult stages are responsible for transmission. Larvae are not going to transmit any thyliriosis. So about the pathogenesis, multiplication occurs in the lymphocytes, as I have told you, wherein the scissions, that is Koch blue bodies, they are will form. The infected lymphocytes are ruptured and the scissions are released. So this I will tell you by diagram. So after the tick bite, the entry of the parasite, that is the sporozoal stage, they goes in the lymph gland, affect the lymphocytes, and multiplication occurs in the lymphocyte by schizogony. We call it as scission, that is Koch blue bodies. Then because of Koch blue bodies in the lymphocytes, hyperplasia of the gland is there. Then the lymphocytes, infected lymphocytes, which are having the Koch blue bodies, some of them they break open, and whatever the scission is there, it breaks, and it enters the whatever the products is there, the merozoites, they enters in the RBCs, and it is called pyroplasm. Once it enter in the RBCs, it is called pyroplasms. And the stage pyroplasm, the RBCs containing pyroplasm, they are taken by the tick stages. They are taken by the tick stages, not the Koch blue bodies. So RBCs containing the pyroplasms are responsible for transmission of the disease. Oh. So what are the characteristic symptoms of thyleria? Again, high fever is there, anemia is there, enlargement of the superficial lymph nodes is there. I will show you the photos. Then very rare occasion, hemoglobin urea may occur, but otherwise hemoglobin urea is not there. Then lacrimation, serous nasal discharge, salivation, muscular tremors, milk production get decreased, dyspnea, diarrhea with mucus and blood may occur. So this is again another important clinical sign in case of thyliriosis in the adult animals. Diarrhea with mucus and blood occurs. So because of this diarrhea with mucus and blood, this is also one of the important clinical signs of thyliriosis. And most of the time what we do, if diarrhea is there, we treat the diarrhea with different antibiotics, but we do not get response. So such diarrhea, which is not responding to common antibiotics, is the diarrhea caused by the thyliriosis. And in some chronic cases of thyliriosis, I have seen that as such diarrhea is not there, but semi-solid feces is there. Semi-solid feces is there, and the emaciation is there, day by day emaciation is there. So such cases they are positive for thyleria. So you can see here enlargement of the superficial lymph nodes, then watery nasal discharge, then lacrimation. Then you can see very well appreciate that depression, the animal is under depression. Then the conjunctival hemorrhages are there, subconjunctival hemorrhages are there. Then hemosis is there, exophthalmosis is there. So whatever these pictures of exophthalmosis are there, they are there. I have taken them from the Journal of Veterinary Parasitology, and this is a paper published by one of the Iranian person, Iranian veterinarian. So you can see unilateral exophthalmosis, bilateral exophthalmosis, and particularly exophthalmosis. What I have seen that it particularly more common in the HF as compared to the Jersey. So HF it is more common. Then diarrhea with mucus and blood, and then swelling of the joints. So here the right carpal joint is being swollen, but all four joints may get swollen in thyliriosis. So that is again another important character of thyliriosis, swelling of the joints. And this swelling of the joints, because it is full of fluid, you will find it, the fluid is there, so it puts on pressure like edema, and even if you prick a needle, only clear fluid comes out. So don't prick a needle. It is the edema, because the lymph nodes, they are blocked. The lymph channels are blocked, and that's why this lymphatic fluid, it cannot be drained and it remains at the joints. So skin lesions may occur. Then in buffaloes, in very few cases, you will find the corneal opacity and bluish discoloration of the eye in buffaloes. This particularly I have observed this. Then about the macroscopic features, enlargement of the lymph nodes and spleen, and the another important thing is puncture ulcers on abomasum. So splenomegaly, enlargement of the lymph nodes, abomasal ulcers. These are the features on the postmortem. Then tracheal froth may be there. Then artifacts in the kidney. Infarcts in the kidney, and white nodule lymphatic infiltration in the kidney. Then ecchymotic hemorrhages on pericardium and epicardium. So again, diagnosis remains the same by blood smear examination and by symptoms, signs and symptoms. So blood smear examination, I don't know whether you will be able to see, but you will get the ring. The bottom of the ring is thick. And you can appreciate here that the RBCs of this cattle near about 6 to 7 microns, whereas the parasite is 1 to 1.5 micron in diameter only. So they are very small, and if the staining is clear, you'll be identifying, because this is a signet ring appearance is there. So here signet ring appearance is there. So Koch blue bodies, they are present in the lymphocytes. So these are the Koch blue bodies in the lymphocytes. So this staining is not good, but anyhow, this Koch blue bodies can be seen. This Koch blue bodies again can be seen in the blood smear. When you stain the blood smear, the Koch blue bodies are being seen. Then coming to the treatment, buparocone, that is 2.5 milligram per kg body weight. So buparocone, 5% buparocone in the field, 1 ml per 20 kg body weight is given. Of course, supportive treatment includes the antibiotic. Generally, tetracycline should not be used in case of theileriosis, because if you use tetracyclines in the theileriosis, when we are using buparocone, because tetracycline, they are effective against the pyroplasms, but not effective against the Koch blue body. So what happens after giving tetracycline? It gives you a temporary result. And again, the Koch blue bodies, they multiply, and they again comes in the RBCs as pyroplasm. So the disease again appears. So instead of, and again tetracyclines, they cause deficiency, deficiency of the phosphorus and calcium, or the as chelation of the phosphorus and calcium occurs, and they becomes at lower level, which in fact is important in hemopiosis. So calcium and phosphorus, they have got a role in the hemopiosis, and that's why anemia is there. If you use more anemia is there if you use the tetracycline. So you can use the enrofloxacin or any other antibiotic. That is the choice of your antibiotic. So that Butacure is there, manufactured by Assist Life Sciences as buparocone 5%. Then coming to the prevention and control, tick control, that we will take later on. Hemoprophylaxis, we have already seen the buparocone 5% is there. Then biological weapon, commonly this vaccines they are being used. So in India, one of the companies marketing the anti-thalidomide vaccine. Then coming to the acaricide control. So acaricide, different acaricides are there, that I will tell you later on. But in African countries, like say these dipping tanks are there, they are prepared. Then powerful spraying is there with jet pumps. So these are there to control the ticks. The importance of this I will tell you later on when we will take the ticks. So in India, this Rakshavakti vaccine is available, but again, it requires liquid nitrogen and rather difficult to carry in the village levels. So coming to another important disease, that is babesiosis. So I will just hurriedly go through this babesiosis. Again, it is a very, very important disease. But in the field, commonly we diagnose this babesiosis from hemoglobin urea. Now, what is the difference between a hemoglobin urea and hematuria? So again, when babesiosis is there, babesiosis, high temperature along with hemoglobin urea is babesiosis. So what is the difference between the babesiosis and hypophosphatemia? So in case of babesiosis, high temperature hemoglobin urea, whereas in case of hypophosphatemia, the hematuria is there. So as such, the blood cells, they come in the urine. So if you take the urine in a bottle, plastic bottle, say transparent plastic bottle, you will find that the the urine it settled down. Whatever the blood in the urine is there, it settled down at the bottom. So that is the difference. Again, hypophosphatemia, there is subnormal. There is the temperature may be normal or slightly subnormal. So that is the difference between these two. Then the about the pathogenesis, again, it is transmitted through the trans-ovarian route. This is very important because once the female tick is infected with Babesia bigemina, Babesia bovis, so you will find that the uh, the progeny of the tick get infected because there is trans-ovarian transmission is there. So once the female tick is infected, her progeny remains infected for lifetime. So every generation of the tick remains infected and transmitting the disease. So incubation period 5 to 10 days. And of course, we know that these parasites, they multiply in the red blood cells and they break open the red blood cells, causing the breakage of the cells. And whatever the hemoglobin that has been released in the blood, the kidneys cannot filter this hemoglobin because it is excess in quantity. So it is above the threshold level, and that's why, as such, the hemoglobin is thrown in the urine, so causing hemoglobin urea. Of course, the immunological mechanism also contributes to this mechanism, as such that the soluble antigens of Babesia, they coat the uninfected RBCs, and to these uninfected RBCs, the antibodies, they get attached and they destroy, an antigen antibody complex is formed and they destroy the uninfected RBCs also. And that's why the hemoglobin level in the blood goes above threshold level and the kidney cannot filter and it is voided out in the urine. So important characteristics: high fever, anemia, icterus, hemoglobin urea, initially profuse diarrhea followed by constipation is there. Then the cerebral babesiosis may be caused by Babesia bigemina or Babesia bovis, wherein ataxia, paddling of the limbs, parasites accumulate in the cerebral capillaries, and the animal may die within 12 to 36 hours after the onset of the clinical signs. And the important thing is that there is very, very less parasitemia in the blood. So only expert can diagnose this very, very few parasites. Means in a complete blood smear, sometimes you may get a single red blood cell infected with the parasite. So, this is the job of the expert to diagnose this disease because this generally the whatever the parasites they are there, Babesia infected cells, they are there, red blood cells, they are there. They accumulate in the cerebral capillaries, blocking the cerebral capillaries, blocking the blood supply to the brain, and that's why leading in ataxia and paddling of the limbs and coma. Of course, the treatment remains the same. So these are macroscopic features already we have discussed. Then diagnosis, of course, by demonstration of protozoan parasites in the blood smear. So you can see here, these are the Babesia parasites, pear-shaped Babesia bigemina at an acute angle with each other. So once the slide is stained properly, you will be able to see. Coming to anaplasmosis, again the tick-borne disease caused by intracellular bacteria, and the anaplasmosis is usually anaplasmosis. They are present at the margins of the RBC, that is anaplasma marginally. If they are present in the center of the RBC, they are anaplasma centrally. So anaplasma usually is subclinical in animals less than 1 year old. So in the yearlings and 2 years old, it is moderately severe, and in older animals, it is severe and often fatal. So as the age advances, the animals, they are more prone to anaplasmosis. Up to 1 year, no danger. But after 1 year, the anaplasmosis is severe as the age advances. So it can be transmitted by ticks as well as biting flies, as well as even if we use the unsterile needles. So sometimes some practitioners, they use the same needle for vaccination of different animals, or sometimes for treatment of different animals. They don't throw the needle, they don't sterilize the needle. Nowadays, there is no question of sterilization. It is a disposable needle, so you have to throw it out. But some physicians, they don't throw the needle and use it, and may transmit this anaplasmosis. So occurs in tropical as well as subtropical countries, and acute and commonly fatal disease in cattle up to 3 years of age. So the clinical symptoms remain the same: increase in body temperature, that is fever, anorexia, anemia, depression, dehydration, labored respiration, and again sometimes abortion. And the milk flow remains suspended. Extensive salivation and rapid respiration may be there. Then whatever this hemoprotozoa we have seen, we have to prepare a very good blood smear and send it to the laboratory for the examination. So for the laboratory person, the field persons are very important, because if the field persons, they send the sample, proper sampling to the laboratory persons, it becomes easy for them to give diagnosis. But if the smears are not good, then the laboratory person will say the smear is not fit for examination and return it to you. So till that time, the animal will die. So for that, you have to prepare a very good blood smear. Now the blood smear for diagnosis of the hemoprotozoan must be prepared from the ear vein, and not from the jugular vein. Under extreme conditions, when the animal doesn't cooperate, at that time, we may accept the jugular vein blood smear. Why? I will tell you later on. So you take a drop of blood on a clean glass slide, then take the another spreader slide and take it back in the. So take a drop of blood, take a spreader slide, and at an angle of about 30 to 45 degrees centigrade, let the spreader slide to spread the blood, and then with one jerk, you move the spreader slide in the front side. So that will prepare a very good blood smear. It's a very simple thing, you might be knowing, but remember, the drop of blood should be very small. very small, maybe 1 microliter or 2 microliter hardly. So how you will measure this microliter? So whatever the drop that comes at the needle. So when you press the syringe at that time, whatever the small drop that comes at the mouth of the needle, at the tip of the needle, that much drop is sufficient for preparation of the blood smear. Then after preparation, let it dry. Immediately it will dry within say 1 minute. And after drying, wrap individual blood smear in a piece of paper, label it and send it. Most of the time, what happens, sometimes some field persons, they do not wrap the blood smears individually. They wrap all the blood smears in one paper and send. So that is not the procedure. So wrap the individual blood smear in a piece of paper, clean paper, and then send it to the laboratory. So, if the laboratory is far away from your place, you may go for fixation of the blood smear with methanol. So you have to keep the blood smear on a staining rack. Just add few drops of methanol to it. Wait for 1 minute. After 1 minute, decant methanol, let it dry, and send the and after wrapping the blood smear, send it to the laboratory. So it becomes very simple. But the blood smear should be sent only wrapped blood smear, not the open blood smear. So that is about the blood smears. So because it is very important for the laboratory persons. So you will get, if the blood smear is very good, you will get immediate results of the blood smear. Then about the ticks, which are the vectors of say the anaplasma, babesia, theileria. So what is, because to control the tick, we must know the life cycle of the tick. So what are the ticks? There are three types of ticks are there: one host, two host, and three host tick, depending on the animal host required for completion of the life cycle. So how? Firstly, we will go. This is a picture from one of the book, wherein how the tick they feed. So this is very important because see the ticks, they feed whatever their mouth is there. These parts are there, hypostome and chelicerae. These parts they are embedded in the skin, and these are the palps. So these pulps remain outside. Here, the tick, it secretes the cementing substance and it is blocked. So this creates a vacuum, and then the blood is being sucked. So here, the blood vessels, whatever the smaller capillaries they are there, they are being cut by this mandibles and chelicerae, and then the blood is being sucked. And how the blood is sucked? Because vacuum is created here. Here, the cement is there, and because of this cementing substance, vacuum is created, and then it is being sucked. Then whatever the ticks they are there, their mouth parts are inside the skin, and on this the hairs are there. On the body of the ticks, the hairs are there. So that's why unless and until they grow in size, they are not visible. Larvae in the tick not visible. Smaller nymphs not visible. And only the adult ticks are visible because the adult ticks are more in height than the hairs. Otherwise, they are below the hairs. This will be important for the treatment of the insecticide. So, the life cycle of the three host tick. So, whatever this female tick is there, which is grayish in color, it lays about 4,000 to 5,000 or no more than that, depending on the species of the tick. Eggs in the cracks and crevices of the animal house, or maybe under the under the stones, under the wood, or whatever the places they get for hiding. And after 4,000 laying 4,000 to 5,000 eggs, the tick dies, and then the larvae they comes out, they attaches to the first host. Sorry, they attach just a minute. They attaches to the first host. The larvae they attaches to the first host. Then these larvae they after sucking the blood, sufficient blood, they comes on the ground and they mold to nymph. Whatever their upper cover is there, chitin cover, which is very tough, So the tick cannot grow. So the tick, it molts, it throws out the cover and get converted into nymph. Then the nymph again feed on the another animal. After feeding on the another animal, the nymph again goes on the ground and grows in size. Then here the males and females are being identified. And then these males and females again they attaches to the third host, and the males and females they copulate, and the eggs and the female then comes after sucking the blood of the third host, it comes on the ground and lays the eggs. So this is the life cycle of three hosts. So here why I have shown you this, because here we should know where the eggs they are being located are laid by the ticks. We should know that the larvae they are on the ground or on the grass blades. Nymph is also on the grass blades, and the males and females, adult male and female, are also on the ground. So this all these stages they are present on the ground, and that's why we suggest the another method, that is burning of the floors. So then the host that transmits the tick species that transmits the babesia. So one host tick, once the larvae they attaches to the host, on the host only they are converted to nymph and adult, and then the adult it goes down and lays the eggs. So that's why one host tick requires only one host for the life cycle. Then control of these ectoparasites. So why control? As I have told you, their biotic potential is very, very high, and that's why only control is possible. Eradication is rather not possible because of their biotic potential. So control of the ectoparasites by application of the insecticides to the animal body by using spray or wash. Then injectables, ivermectin, doramectin, moxidectin, they can be used. Ivermectin is rather preferable because it is rather cheap. And the pour-on preparations. Commonly, this pour-on preparation we use in in the dog because they are easy to operate and all these things. Pour-on preparations are also available in cattle and buffaloes also. Just a minute. So there are different groups of insecticides, like say amitraz is there, that is one group. Then the organophosphorus compounds are there, like dichlorowas is there. Then organochlorine compounds are there. Then the semi-synthetic pyrethroids are there, that is the deltamethrin, decamethrin, flumethrin are also there. So this is the cypermethrin. So all these methrin compounds, cypermethrin, decamethrin, deltamethrin, flumethrin, they belongs to one group. And of course, remember, when you use amitraz, next time you use any methrin compound. But if you use cypermethrin for the first time, next time don't use flumethrin, because this is one group. And if the resistance occurs to one species or one item or one ingredient of this group, that is cypermethrin, if the resistance occurs to cypermethrin, it becomes resistant to all methrin compounds. So use the amitraz. After using amitraz, you may go for the dichlorowas or organophosphate compounds, or sumithion, malathion, which are organophosphorus compounds, and then you can use the again you can use the semi-synthetic pyrethroid compound. So you have to change the group of the insecticide. So again the same deltamethrin, then flumethrin. This is also manufactured by this company. Now, how to apply these insecticides to the animal body? Because every time, whenever you prescribe the insecticide to the owners, maximum time they say these insecticides, they cause toxicity. So toxicity only occurs because they do not properly water the animal before applying the insecticide to the animal body. So that's why precautions I have written: give some feed to the animal. After taking some feed, the animal give water to the animal, water the animal, and the animal will drink sufficient water. Then keep the bucket of the insecticide away from the other animals so that the animal should not drink the diluted insecticide. The human beings who sprays should use the gloves and mask, and the instruction should be to the farmer that this is to be carried out after 10 a.m. Why? Because up to 10 a.m. generally the farmers they are busy with milking procedure, or they are busy with the other operations. And after 10, some relaxed time is there, and at that time they may apply the insecticides to the animal body by taking proper precautions. The most important precaution is that the animal should not be thirsty. So this is just a photo of spraying the buffaloes. So buffalo spraying is very easy as compared to cattle. So in cattle, you can see the jet pumps they are being used. Why jet pumps they are being used? As I have shown you the figure, that the mouth of the tick is embedded in the skin and the hairs are there on the skin, on the tick. Now, as the hairs are there on the tick, if we spray it with simple sprayer, the droplets of the insecticide they get dry after some time on the hairs only. And whatever insecticides, amitraz, or the semisynthetic pyrethroid compounds, or organophosphorus compounds, organochlorine compounds, we are using for controlling these ticks, they are contact poison. There are different types of poisons are there: contact poison, stomach poison, fumigant, so many are there. But in veterinary, we are using contact poison. So contact poison means the tick should get wet for 2 minutes, and then the insecticide is absorbed through the chitin and knockdown effect occurs. So the insecticide must remain for about 2 minutes. And that's why I always insist that the skin of the animal should get wet. Skin of the animal should get wet. You, if it is possible, you can use dips. That is the best method. But again, for dips, you will require more amount of water, more amount of the insecticide. Then dips. So that is the disadvantage of the dip. Otherwise, dip is the best. Then spraying with the jet pumps is best, because spraying with jet pumps, it can go up to the skin level and can kill the ticks. Then different sprayers and different designs are available for spraying of these insecticides. So then we can use as I have told you, that whatever the larvae, nymph, and adults they are present on the ground, and the eggs they are being laid by the tick in the cracks and crevices on all and of the house. So if we burn the floor of the house with a flame gun, then there is no question of these ticks. So you may burn the floor of the house with a flame gun. So here I will show you. Oh, oh, what happened? This I will show you later on, the video. So the ectoparasiticides for dog.
Video then, sir.
Yeah.
Process
So
fine.
yeah. Just within 1 minute I'll finish.
Okay.
So whatever the ectoparasiticides for the dog, generally spot-on liquids are preferable in dogs. So the isoquinolone tablets are available, like say the fluorolaner compounds, apoxolaner, saloranair compounds. Their tablets are available. but spot-ons are preferable in dogs. So spot-on, like say fipronil spot-on is there, depending on the body weight, the dose rates they are being given. Then the silamectin is also available, one of the best the macrolide compounds. Silamectin is very good and giving very good results in case of the small animals, dogs particularly. So these are also some products, Z-Master and Z-Master Cat. Then another important, the video of this thing I will show you later on. About coccidiosis, I will go hurriedly. So the most important thing about coccidiosis is that it is a disease of bad management. So bad management, when the bad management is there during rainy season, bad management is there. So that's why the coccidiosis is common during rainy season. And they are intracellular parasites occurring in the intestine that everybody knows. They are very host specific. How the coccidia of poultry does not infect other birds. Coccidia of the poultry does not infect the cattle buffaloes. The coccidia of cattle buffaloes does not infect the goat. Coccidia of the goat does not infect cattle buffalo and vice versa. So they are very host specific. Each and every species has got different species of coccidia. Then they are tissue specific, they are immune specific also. So dryness and direct sunlight, they are lethal to them. This oocyst in the environment under natural conditions after sporulation remains for live for several years. Then they are very host specific. They are intracellular parasites. So life cycle is very simple, that the infection occurs by ingestion of the sporulated oocyst. Remember, Eimeria oocyst, it contains 4 sporocysts, each containing 2 sporozoites. So each of the Eimeria oocyst gives rise to 8 sporozoites. That means each of the Eimeria species oocyst will infect 8 cells. Then after infecting 8 cells, the in each of the sporozoid forms the zygent. This first generation zygent releases large number of merozoites. So after releasing the merozoites, these merozoites penetrate in these cells, another epithelial cells, and again multiply as a zygent, releasing the uh, uh, the again merozoites. And then this goes on. This goes on. So it is a continuous process. So large number of such merozoites, they have been formed, and then ultimately these merozoites, they enter the uh, uh, epithelial cells to form the male and female gametes and giving the oocyst, which is passed in the feces of the host. So mode of infection, of course, occurs by ingestion of the sporulated oocyst, and the mode of transmission occurs by ingestion of the contaminated feed and water. Then typical hemorrhagic diarrhea, inflammation is there. In case of poultry, number of species are there: Eimeria tenella, maxima, mecatrix, bruneti, all are there. In broilers, again, very heavy mortality can occur in broilers. Then in bovines, ovines, caprines, so in the cattle, buffaloes, sheep, goat, diarrhea and dehydration are major clinical symptoms, and particularly coccidiosis is a disease of young animals, young birds and young animals. So in case of poultry, the disease occurs after 21 days. Whereas in case of the cows, the disease occurs after about 15 days or 20 days later on, because after 15 days or 20 days, when the calf sucks the mother's milk, at that time, whatever the oocysts they are there to the teats of the mother, they get ingested, and then the diarrhea can occur. So it is the disease of young ones and not the adults. So already I have told you. And prophylactic use is the use of the coccidiocidal drug. So what are the different classification of the coccidiocidals are there, like say chemical coccidiocidals, robenidine is there, diclazuril, dicoquinate is there. Ionophorus are there, monovalent and divalent ionophorus are there, like say maduramycin, salinomycin, monensin, naracin. Then depending on the chemical structure, the or depending on the action. So amprolium is there, which is quite preferable, which is thiamine antagonist. So it deprives the coccidia for thiamine, and eventually, because the coccidia cannot consume thiamine, the coccidia they die there. So that is amprolium. Then ionophorus, like say monensin, lactulose, all these things they are being used. So different groups are there. Then particularly in case of the large animals, we use amprolium and tolterazuril. So tolterazuril and the amprolium, they are preferable drugs for large animals. So this tolterazuril is manufactured by this company as Tolteradox, one of the best compound, but I think slight high price is there of this tolterazuril in market, because this is quite best product. Then we can the mechanism of action is there. They are thiamine antagonist. So amprolium available in the market, and so these are all mechanism of action is there. Then ionophorous compounds are there. They are very good as the preventive measures and commonly used in poultry. Thank you. So just I will end this, and I will show you the uh, just a minute, just a minute. Okay. So flame guns can be used. So now the time is over. So flame guns, you can see the videos. They are available on the net. Flame guns. Thank you. Thank you, Dr. Abhijit.
Sir, are you not able to present the video now? Hello,
What?
that video you are not able to present now?
Yeah, presentation is over.
No, I'm asking
Yeah,
like
video is there. Video is there, but you have blocked me
one,
for sharing the screen.
one,
So I
sir,
cannot share.
we're sharing it right now.
So what I will do,
1 second, sir. We are just giving the access. So once you stop the presentation,
yeah.
it automatically restricts the.
Now sharing the screen.
Now I
Okay,
can
okay,
share.
okay. Just a minute, just a minute.
No, they have access.
Just a minute, just a minute. So because this video doesn't runs in this thing.
Okay, sir. Then if it's
Okay, now started. Just it is a few seconds only.
but it's not coming in our screen, sir.
So this is a video from Punjab.
It's not showing. Maybe you can minimize the.
So can I just minimize the presentation and see for the video, because we are not able to see the video. We can just see the PowerPoint only, sir. Hello.
Okay, okay, thank you.
Okay, sir. Video was not coming in our screen, but that is fine. I think we'll move forward with the question and answer session.
Yeah.
Thank you so much, Dr. Kolte sir, for this insightful and enriching presentation. I'm
Yeah.
sure everyone here has gained a lot of practical takeaways from your talk. So on behalf
Hello.
of Party Life Science Private Limited, I would like to
Oh,
extend heartfelt thanks to all the participants who has joined us across from the world. And then we'll be going to the question answer session. So some people have asked some questions here. So I'll read out the questions, sir. So
hello. No,
Hello, sir.
हा.
येतोय तुमचा आवाज?
हो ना, आवाज येतोय. पण माझ्या याच्यावर ते फुल स्क्रीन दिसत नाहीये. ओके, ठीक आहे ना. बट मला तुमचा आवाज नाही येत आहे म्हणून म्हटलं मी. बा ओके ओके ओके. Hello. Screen share. Now all right. But
now,
but I'm not getting your voice.
so it might be the issue of the earphone, I guess. Or
Hello.
given the set.
अरे यार वो last time also same thing happened. Now again the same thing. Just a minute. Okay. Hello. Hello. Oh, what happened? लॅपटॉपवर लवकर ऐकू नाही येत ना. That is the problem. Just सेटिंग थोडंसं मी चेंज करत आहे. हॅलो, आता बोला.
आवाज येतोय?
Sir, am I audible?
हा. Now audible. Okay.
Questions.
Sir, okay, then we can move forward with some question answers. Many people have raised some, asked for many questions regarding.
Yeah.
So I'll read out the questions. You can
Yeah.
answer one by one then.
Yeah.
Okay, so Mr. Lemali Kibirti has asked, does Ashish Life Science have a field rapid test kit for trypanosomiasis? If yes, what is the pricing timeline? So I can answer that question because currently we are working on many rapid test kits. We are under its processing
Yeah.
of team.
Yeah.
Currently, we do not have a rapid test kit for trypanosomiasis, but eventually or soon we'll be launching or we'll be coming up with a rapid test kit. So Desi has asked how do trypanosomia affect the respiratory system and cause dyspnea? Maybe
Dyspnea.
dyspnea.
Yeah. See, whatever these trypanosomes they are there, they cause severe anemia. Once severe anemia is caused, so whatever the process of whatever the hemoglobin is there is reduced, and the process of oxyhemoglobin is not formed inside the lungs, and that's why it cannot whatever the cells they are there, they cannot take the oxygen to the different parts of the bodies, which results in dyspnea. So because oxyhemoglobin is not formed.
So we'll go to the another question by Abbas Dominic Ongiara.
Yeah.
How about ethidium bromide? I think he has asked about treatment for trypanosomiasis.
Yeah, but see, ethidium bromide is a quite old treatment and has got some side effects also. So that's why it is discontinued. Nowadays, nobody use ethidium bromide because it has got some disadvantage. Exact disadvantages I don't know, but somewhere I have read in book, older books, newer books are not having ethidium bromide, but in the older books it is written that it has got some side effects, and that's why ethidium bromide is not been used. Whereas whatever these new drugs they are there, like say isometamidine is there, quinapyramine is there, they are very good, they are very effective, and again they are easily available, and that's why they are being used. Oh,
Okay, sir, thank you. Then question by Master Asna Q.
yeah,
Why hemoparasitic diseases are commonly known by symptom of recurrent fever?
yeah. See, recurrent fever. Why recurrent fever occurs in case of the hemoprotozoan diseases? We call this as the successive waves of parasitemia occurs, because whatever the parasites, like say, take the example of trypanosomes. So when the trypanosomes they come in the blood, firstly, high number of trypanosomes they are been formed in the blood. So the curve goes up, and then at one place wherein the body immunity starts killing these trypanosomes, the trypanosomes their multiplication goes down. So they get killed. Then some of the trypanosomes immediately, as they come to know that the antibodies they are active, they change their antigenicity and starts multiplying again. So likewise, after multiplying again, the second peak is there. On the second peak, again the body starts producing antibodies against these trypanosomes. And then after some days, the second peak also goes down. And again, the third peak occurs as the trypanosomes they start multiplying. The new type of trypanosomes they start multiplying. So successive waves of parasitemia is there. Similarly, in case of babesiosis also. In case of babesiosis, if the animal suffers from babesiosis not treated, then what happens? Whatever the babesia they are there in the RBCs, they multiply, they break open the RBCs, again they goes in the new RBCs, and at that time the temperature and all these things goes down, and as soon as again they start destroying the new RBCs, then second peak occurs. So successive waves of parasitemia occurs in the parasitic infection because of these things. Similarly, in case of the Theileria also, successive waves of parasitemia occurs in these animals. And if you use a proper drug, like say Theileria is there, if you use buparvocone, then this multiplication stops, and you will find that the animal is under the phase of recovery. Okay.
Okay, sir, thank you. Mr. Marshad SMQ has asked, is there any certification after the session ended? So we'll be giving certificates to all the participants who has got complete attendance in the webinar. Everyone will be provided with an e-certificate. So anonymous attendee, someone has asked how intermediate hosts like ticks and fleas are the causative agents.
No. See, they are not intermediate hosts, they are the vectors.
Hmm.
They are the vectors. Intermediate host, the word comes in helminths. So whatever the ticks they are there, for example, I tell you about Theileria. So Theileria is transmitted by three host tick, maybe Hyloma, or say maybe Theileria orientalis may be transmitted by the Haemophilus, or Theileria parva may be transmitted by the Rhipicephalus. All are three host tick. So what happens to the Theileria infected animal? When the larva bites, it takes the RBCs containing the pyroplasm. These RBCs containing pyroplasm, the RBCs in the gut, they are destroyed and the pyroplasm gets free. Then this pyroplasm eventually converted into the macrogamete, microgamete, and ultimately a oocyst is been formed inside the intestine of the tick. And this oocyst, it penetrates the wall of the intestine and goes to the salivary glands. And in the salivary glands, sporulation of the oocyst occurs, releasing these sporozoites. So large number of sporozoites, they are being formed in the salivary glands. And then the, the larva, when it drops down and converted to nymph, after the nymphal stage, these sporozoites are transmitted in the another host. So the larvae do not transmit the disease, but the nymph and the adults, they are responsible for transmission of the disease, and they are biological vectors. As such, the parasite, it multiplies thousands times in the body of the tick, and then it is transmitted. And as I told you, in case of Babesia, it is trans-ovarian transmission is there. Once the tick is infected, her whole progeny remains infected lifetime. Thank you.
Okay, so thank you. So, Mr. Amedu John has asked, good morning, sir. Kindly explain more about vaccine in theileriosis. And also, Mr. Sunday Kajange has asked, economically speaking of African dairy farm, is it sound to vaccinate theileriosis? And one more question from Sunday Kajange, that what is good between vaccination and tick control, speaking of theileriosis? So all these questions are related to vaccinations.
Yeah. So the best way to control theileriosis is controlling of the ticks. Best way. If you control the ticks at your farm, the theileria doesn't get transmitted. But about vaccine, I am rather against of the vaccination, because theileriosis vaccine is prepared from the infected lymphoblastoid cells, and these lymphoblastoid cells, they are being passaged for say 120 times, 130 times. But even after 130 times passaging, the parasite remains potent pathogenic. And what I have observed, that after giving this vaccine, the outbreaks have been occurred. And if the vaccine is given, your animal will suffer 100% with theileriosis, but you will not treat the animal with theileriosis, because you say you have vaccinated the animal. So you will never think that the animal will suffer from this disease. And typical clinical symptoms will not occur after vaccination. Only symptom that occurs after vaccination, you will find that the animal, the health of the animal is going down day by day, not responding to any treatment, and not giving proper production, not there is infertility, the animal doesn't come in it. So many problems that arise because of this vaccination. So I am rather against of the theileria vaccine. And yes, tick control by using different methods. And of course, in case of tick control, you have to use 2-3 methods simultaneously. We call it as integrated parasite management. So integrated tick control is very important. You have to use flame gun. Simultaneously, you have to apply insecticide to the animal body. Simultaneously, you have to inject ivermectin. So 2-3 measures at a time you have to give. Then flame gun, you have to use the flame gun weekly basis. Then application of the insecticide, say if you are using it on the weekly basis, say 3 to 4 times, then discontinue for 2-3 months. Again, after 2-3 months, you can continue the dipping. So likewise, you have to formulate the strategy for controlling of the ticks. Yeah.
Okay, sir. Then Abbas Dominic Ongiera has asked, is there any possibility of extending the Ashish Life Science services to South Sudan, as it has large population of livestock, but limited veterinary service? So we are already thinking of expanding our services, our business to different parts of the world. So it is also there in consideration, and the remaining details will be shared soon. And also, Mr. Daniel Mwangoka has asked, are those spot-on or chewable acaricides for dogs and cats available in the market? If yes, are they available in Tanzania? So, our product called X-Free, where the content is fipronil 10%, is already there in the Tanzanian market. And remaining products also, we are in plan of launching it in coming days or coming time. So, that currently our X-ray spot on is available. So these two questions were towards our side. So Dr. Bernard has asked, among all the hemoprotozoan diseases discussed, which ones have rapid diagnostic tests to quickly use in the field for quick results?
Rapid diagnostic tests. Generally, whatever the rapid diagnostic tests for trypanosomes they are there, they are not specific. So instead, rapid diagnostic tests, if you have a good parasitologist or good pathologist who can examine the blood smear, but only thing is that you prepare a very good blood smear from the ear vein and send it to the laboratory and get it confirmed. And once you find that a particular area is having, say, I have sent 10 blood smears to the laboratory and I have find that all are positive for theileria. That means whatever the clinical symptoms are there, they are of theileria, and then depending on the situation, you can treat the animal. So, preparation of the blood smear in the field and sending into the laboratory is the cheapest method to diagnose the disease. And as such, there is no any penside test available for diagnosis of this hemoprotozoan infections in the field.
Okay, sir. Desi, only 3 more questions are there. We'll finish that and we'll be moving on to the selection of our lucky winners.
Yeah.
So, Desi has asked why anaplasmosis is more severe in older animals.
Anaplasmosis is severe in older animals. See, maybe one of the reason the whatever the younger animals they are there, or whatever the cows they are there up to 1 year of age, they are having maternal antibodies, and that maternal antibodies, they are so much so strong of the babesia also. In babesia also reverse age resistance is there. So the calf up to 1 year, 1 year of age generally do not suffer from babesiosis. So that is reverse age resistance, and that mainly it occurs because of the maternal immunity. So maternal immunity, it comes through colostrum, and that is the only reason for anaplasmosis. That anaplasmosis is not severe in the very young animals, whereas it is more severe as the age advances. Okay.
Dr. Adene Saifu has asked, for effective control of one host and three host tick strategically, which cycle are more effective for controlling larval stage, nymph stage, or adult stage?
Which?
For effective control of one host and three host tick strategically, which cycle are more effective for controlling larval stage, nymph stage, or adult stage? So,
Actually, as such, we cannot say cycle. So, whatever the, as I told you, that the adult tick, then the larva which after feeding, which molts on the ground, the nymph after feeding, which molts on the ground, and the adult female which comes on the ground for laying the eggs. So all these stages, they are present on the ground, and these stages we must control by using the flame guns. So you have to burn them. Don't use or don't spray insecticide in the shade, because that will spoil your environment. And another thing, as I have told you, that the insecticides, they are effective only when the tick remain in the insecticidal solution for 2 minutes. So when we spray the insecticide solution on the ground, it is been absorbed by the ground, and the tick doesn't get wet. The tick remains in the cracks and crevices or under the stones or under the any of the holes. So the insecticide doesn't get in contact with the tick. It doesn't dies. The best method is to kill all the stages on the ground with the help of a flame gun. So that is one. And as I told you, integrated parasite control, simultaneously use ivermectin, simultaneously use the dip or power spray. Okay. Okay, Abhijit.
Okay, sir. Thank you. So this will be the last question asked by Banjkise Mekonnen.
Yeah.
So after that, we'll go to the lucky wheel spinning for selection of the winners.
Yeah.
So he has asked why we take blood samples from ear vein
Yeah.
other than in case
That
of
was expected. This question I was expecting because you know what happens. Jugular vein, whatever the jugular vein is there, it is a big pipe, and the blood is continuously flowing through the jugular vein, and the whatever the ear veins or ear capillary, the capillaries they are there. So we know that in the smaller veins, the flow of the blood is rather slow. Arteries, the flow is very fast. Veins, they are having the walls, and their flow is rather slow. So when we collect the blood from the ear vein, we will get more number of parasites because the infected cells, they are heavier and their movement in the blood is slower, and they immediately get caught when we take it from a smaller vein. If you take a blood drop from the ear capillaries, that is the best. You will get large number of parasites in that. But if you take the blood from the ear vein, prominent ear vein, still you will get the parasites in the blood. But if you take the blood from the jugular vein, at that time number of parasites are very less. Few parasites may be seen on examination, that too by expert only, very much expert. So generally in the laboratories, experts are very less. So generally they don't spend much time if they are not getting any of the parasite. They just see 2, 3, 4 fields. If they are not getting any parasite, they throw the slide. So that's why the importance of the ear vein is there, and this has been documented by several researchers, and it is given in the articles also, research articles also, that collect the blood from the ear veins. So why from the ear veins? Because that is rather easy to collect, because if we say ear capillaries, it becomes very difficult to collect the blood from ear capillaries. But still, if you are able to take a drop of blood from the ear vein and prepare and able to prepare a good blood smear, it's well and good. Immediately the laboratory person will be very happy and will give you the correct diagnosis within, say, minutes. So that's why the blood drop of blood should be collected for hemoprotozoan from the ear vein only and not from the jugular vein. Okay. Abhijit.
Yes.
Yes, sir. So thank you so much, Dr. Kolte, sir. So we'll be winding up the Q&A session. And thank you so much for that insightful and enriching presentation. And I'm very sure that everyone has gained a lot of practical takeaways from your talk. And on behalf of Ashish Life Science Private Limited, I would like to extend our heartfelt thanks to all the participants who has joined us from across the world, and especially Dr. Kolte sir. And your time, your questions, and your energy truly make sessions like this very meaningful. And do stay connected with us, because this is just a beginning. We'll be hosting more such international webinars in the coming months, featuring leading experts like Dr. Kolte sir from the veterinary and livestock industry. And now, as we have promised, we'll be announcing our 3 lucky winners in just a few moments. So we'll be starting the lucky draw.
My tooth.
Okay, so Mr. Kambe Amuel Dakuyo has been selected as the third prize for our webinar. So he's the third lucky winner for our webinar. Kambe Amuel Dakuyo. Congratulations, Kambe. Yeah, so now we'll be going to the lucky spin for the second prize winner. Yeah, congratulations, Dr. Nigis Bizu. So you have been selected as the second prize winner for our international livestock webinar. Congratulations and thank you for participating in the webinar. So now we'll be moving to the most expected first prize of the webinar. Congratulations, Mengesha Ayehu, for being selected as the first prize winner for our international livestock webinar. So, our team in particular countries where all these 3 winners are staying or residing, our team will be contacting you and they will be giving you the prizes both for first, second, third. And also, I congratulate every other participants who has participated in this webinar. So we'll be coming up with very like number of webinars in the coming months. So we'll be notifying you. We'll be giving all the details regarding all these webinars. So participate in that webinars or coming webinars also, so that you'll also get a chance to be a winner of this webinars. So I once again congratulate all the winners and all the participants for participating in this webinar. Before we end, I would like to say this. At Ashish Life Science, our mission is very simple. We are here to enrich lives through better animal health. So thank you all once again for being part of our today's webinar. And stay curious, stay inspired, and keep making differences one animal at a time. So have a great day or night ahead, wherever you are. So we are signing off. Take care. See you in the next session. Bye.